Can you see the video?
No, doctor.
Huh? Can you see the video?
No, doctor.
Okay.
Is it the second link?
Wait a minute. Why aren't you able to see? I'm just kind of curious. Huh? I'm browsing. Yes. Okay. What about now? Can you see this?
No, Prof. I think because you shared your PowerPoint, but you didn't share your desktop.
All right, 1 minute. Okay, I'm going to leave for one.
Prof, I think you're muted.
Prof.
Okay, I'm going to upload from my computer. I have this particular session. I want to be sure that I'm doing well. Okay, let's start with these determinants, and then 9:14 a.m. Right, and then yes. Okay, let me start with this first then. Okay. Can you see a slide? My slides?
Yes, Prof.
Yes, Prof.
All right, good. So basically right now I'm sharing the file called Public Health Components and Determinants of Health. Is that right?
Yes, Prof.
And you can all see this. Okay, what I will do is then I'll start with this lecture, and then after our break, I will show you the videos. Okay?
Okay.
All right then. Okay, I see a lot of you here. Very nice. I could see plus 92. Total, how many in this class, Jonathan?
119, I think.
119, is it?
Yeah.
Yeah, because I see a lot of you. Yeah, Shafiqa, Shahira, Muhammad Azmi, Muhammad Amar, some of you in your Thai, some of you, I'm sure. I mean, and all of you, I guess, are somewhere either in Cyberjaya or in your homes, right? Am I correct?
Yes.
Okay. All right. All right. This actually is an introductory lecture to public health, and see, for me, if you really want to understand public health, now is the best time to understand it. Sad time, I must be honest, it's not the best time to go through this because with COVID-19, while giving you the best example of how public health works, also tells you how sometimes it may not work. Right? COVID-19 actually is an epidemic, it's a pandemic that has occurred. The last time we ever saw in such a scale was the Spanish flu pandemic in 1918 to 1920. And at that time, 1918 to 1920, 1 out of 3 persons died. Just remember this. How many? 1 out of 3 persons died during that pandemic in the world. And there were 30 to 50 million deaths. We're now touching about 3 million deaths, but at that time, we had 30 to 50 million deaths, exactly about 100 years ago. And 1 out of 3 persons had passed away. That means out of 3 persons, you know, 1 went. Okay, so in public health basically comes into big the understanding of public health comes in mainly to and when we're trying to address such a big issue. Okay, but for today, our learning outcomes, I'll define public health. I'll talk to you about the objectives of public health, where we'll discuss the scope and the main areas of public health activities. The spectrum of health, what's the total spectrum of health from positive to negative health, right? And the different phases of disease occurrence, right? And then we'll also talk about the social determinants of health. These are your learning outcomes for this particular say, and especially in the area of the spectrum of health and the social determinants, very important for you to know and understand. What I will do is I'll go through slowly, no hurry, and we will discuss each one of these. So if I ask anybody, or this is definitely generally the definition of public health, right? It's considered the science and art of one, preventing disease. So mainly disease prevention. Unlike curative medicine, public health mainly deals with preventive medicine. And we all know from the old sayings, Amar and Shafika, that old sayings of prevention is better than cure. So basically when you think of public health, you're talking about preventing disease. Then we are talking about prolonging life. And how like in the 1950s, life expectancy in Malaysia was 58, right? And now it is but 74 for males and 78 for females. So imagine how life has been prolonged over health promotion, a lot of all kinds of activities, including curative medicine. But the whole idea is public health, science and art of preventing disease, prolonging life, and promoting health. All your health promotion activities that are going on, right? And also efficiency. See, only when a person is in good health can we be efficient, right? Okay. But the most important part is this word, through organized community effort. See, unlike curative medicine, it is mainly one-to-one individual medicine. A person comes in, he has a peptic ulcer, or he has got an appendicitis, or he's got an inguinal hernia, or he has got a mental health problem, and he come for treatment. That's individual, all right, one-to-one. Here, mainly whenever we're talking about this preventing disease, talking of prolonging life, talking of promoting health, we're talking about this through organized community effort. That means these efforts are being organized, and generally either by the government or non-government organization, the general public that's out there, right? So we're talking about preventing disease, promoting life, and promoting health. Okay, and all of this actually over the years you will see how developments have occurred. All right. The slides are okay, right? Now you can all see clearly. Just want to make sure.
Yes.
Okay. Now. The WHO actually had a very old and very nice, very clear definition of public health, right? And here it talks about public health having 3 parts. One is the science and the art of preventing disease and prolonging life. That first part we're talking about promoting the health and efficient through organized community effort. So there are 3 components to it. One is preventing disease, prolonging life, and making sure and promoting health. So preventing disease, prolonging life, promoting health through organized community effort. 2 is a major part of public health, Shafika and Azmi and Jonathan and each one of you, a major part of public health that generally the public and all of us know about is where we talk about the sanitation of the environment. Control of communicable infection. Like right now, when you talk about communicable disease, we are mainly talking about control of communicable diseases, control of infectious diseases. the coronavirus, COVID-19 disease. We're talking about controlling this, educating individuals on the principles of hygiene. Like right now, of course, during the the COVID-19 pandemic, we all basically more concerned about hygiene, but it has always been there. I'm sure when you went to school, they always talked about washing your hands when you go before you eat or after you go to the toilet. Please make sure you wash your hands, right? Then, of course, dealing with organizing medical and nursing services. So the services that are being run in the government, in the country, are being run through organized public health efforts. I mean, in the Ministry of Health, all right. In fact, the Ministry of Health is structured in three ways. One is got the Medical Services Division, Public Health Services Division, and then the Research and Development. These are the three big areas in Ministry of Health. So when we think about public health, remember 1/3, in fact, nearly half, either is medical. The Ministry of Health provides medical services through its hospitals and clinics, or provides preventive public health services. So remember, Ministry of Health. So all of you, when you graduate from Cyberjaya, all right, you will either, when you join the Ministry of Health for the number of 4 years and this kind of thing, you'll be either providing any of this within this services that are there. So basically, sanitation of the environment, controlling communicable disease, health promotion by educating individuals, organizing medical and nursing services for, and the main thing is what? Early diagnosis and preventive treatment of disease. So we want to diagnose disease early. Like right now, what's happening in COVID-19? Yes, individuals are there who are sick. They communicate, the disease is transmitted to other individuals, and those other individuals who are the contacts, right? They need to be traced, right? And then they need to be screened to see whether they have been infected or not. And all of you, I'm sure by now, are very clear about the procedures for screening. That means the person comes in, he gets infected, he needs to be quarantined, then his contacts also need to be screened, and if they have disease, they also need to be quarantined. But the minimum is that everybody needs to actually practice SOP. Remember this, all of you, please practice your SOP. Very, very, very important. Okay. So in public health, the second part is dealing with sanitation. And that means this is when you talk about sanitation, we're talking about air quality, water quality, waste management, excreta management, right? The excreta disposal and management, right? That's under your sanitation itself. And communicable diseases, we're talking about whether it's viral or whether it's bacterial or whether it's parasitic, whatever kind of thing. Then we talk about whole area of health promotion and this big area of organizing. So a lot of public health professionals are basically involved in organizing the services that are out there. And the third part that we generally, the medical profession somehow does not think that they are involved in, but are indirectly involved, is the development of the social machinery that will ensure every individual in the community, that means the public, members of the public, achieve a certain standard of living. You must remember, our standard of living, see, our life expectancy has gone up from 58 to 74 to 78 males and females. Our infant mortality rate has gone down. All right, maternal mortality rates have gone down. A lot of the morbidity, a lot of the illness also gone down. Why? Because of we're having developments of machinery that's out there. We're talking about programs, to and every individual a standard of living for maintenance of health, and then to organize the benefits to enable every citizen to realize his birthright of health and longevity. So whenever we think about health, we think of health as a right. All of us have a right to good health. That's why governments around the world make a great effort, make a big effort to ensure that health services are provided, right? So that people are in maintaining good health, right? And of course, pushing towards increased longevity. But when we say increased longevity, we're not talking about individuals who are disabled or going to be what's that, ill for long. We're talking about good health, positive health. Okay, so these are the three areas that we're mainly talking about. One, preventing disease, prolonging life, promoting health. Two, all of these areas within the public health area. And the third, the machinery itself to make sure we are maintaining good health, maintenance of health, right? Okay. That was in the context of this public health, an introduction to public health. Now, what is the purpose of public health? Right, because here you must remember when you think about public health, we're talking about community efforts, right? We're not talking about curative. We are really, and the main emphasis is in the area of preventive health. Okay, so the purpose of public health is to set into effect for the benefit of all the people. You remember this? The words are very broad now. We're not talking about individual medicine. We are talking about public health medicine. The purpose is basically to set into the benefit of the people in a community the practical lessons of preventive medicine. So basically we're talking about preventive medicine, prevention of disease, prevention of, prevention of ill health, okay, prevention of disability, prevention of death, in fact, right? And the scope of this public health work is mainly determined by the knowledge of the causes of the preventable diseases. So if we want to do good public health work, then we need to know what are the causes of preventable disease. Remember this, the majority of the diseases that are out there are preventable. Leading causes of death, what? Heart disease, preventable. Cancer, preventable. Stroke, preventable. Motor vehicle accidents, injuries, preventable. Now, quite preventable, yes. So we need to understand, right? And if we want to do preventive work, we will need to understand and have a good knowledge of the causes of this disease. Like COVID-19, to me, is a very interesting disease where our knowledge of this disease, what is causing it, is evolving. See, I remember March 18 last year when we had our first MCO, right? A lot of us, I'm sure a lot of you also would have thought that this disease is going to last 1-2 months and we will be over with it. I definitely thought that, and everybody in the world also thought in a similar fashion. And suddenly here we have a disease, right, that doesn't seem to stop. We have a virus, we have identified the virus, and not only that, the virus keeps mutating. And we have not only a first generation of mutant viruses, the viruses are mutated, but now a whole second generation of viruses that are, of the virus, the mutant variants that are out there. And the virus, like I was listening to a talk yesterday by a professor from Singapore, right? The infectious disease person there, and he says the way the virus is adapting itself to survive, because the virus wants to survive. The virus wants to go on. Just like us, we want to survive, the virus also wants to stay on, right? And it has kept mutating. And so we need to continue to understand the knowledge of the causes. And I'll continue to use COVID-19 because we are seeing it here. And I remember in the beginning, when the whole question came on about whether it is airborne or it's droplet, how is it transmittable? And whether this whole question of a mask, wearing that mask, whether the SOP, whether it is 1 meter distance or 2 meter distance, how effective they are. So we need to understand about what is the infectious agent in this case. Then we need to understand about how the disease is transmitted. So we want to prevent any preventable disease, and this preventable disease does not need to be communicable. Remember this, even non-communicable disease, heart disease, is preventable. Why? Heart disease, main causes of heart disease, what? Smoking, cholesterol, hypertension, stress, lots and lots of causes, but majority of them preventable. Smoking, definitely. In the physical inactivity, a lot of them. Okay, so we need to identify the causes and so as to prevent them. So we do not know how to prevent all diseases, that is quite clear. However, effective ways to prevent or to reduce the occurrence, at least a dozen diseases are well known now. See, in fact, so far, the only disease that actually in a way we have completely been able to eradicate is smallpox. But for lots of diseases, we are actually now able to reduce, like cardiovascular disease, a better understanding of cardiovascular disease since the 1950s and 60s, right, has led to a decline in the incidence of cardiovascular disease in the West. Yes, the developing countries are seeing this, what do you call that, demographic, I mean, epidemiologic transition, where we have both the non-communicable and communicable, right? But the Western countries, the more developed countries, are already seeing a decline in the non-communicable disease, cardiovascular disease. This. So the purpose of public health is to effect the benefit of all the practical lessons of preventive medicine, have knowledge of the causes and to prevent it. All right, that's there. So now we talk about the scope and the span, how broad this whole idea about public health activities are. One, of course, is environmental control. And when we think about environmental control, we're talking mainly about water pollution, soil pollution, air pollution, right? We're talking about waste management, good water quality. That we need to have good water quality, right? We need to manage our excreta well, and we'll all have all these lectures coming up in the public health module that we have here. Then, of course, another big area is communicable disease control. And whether we're talking about dengue, we're talking about malaria, we're talking about TB, we're talking about rabies, we're talking whatever. And of course, now we're talking about mainly about COVID. It does not mean the other diseases have gone away. Just remember this. The other diseases are also there. Shafika, understand? A lot of other diseases are all out there. So just remember that it does not mean we have COVID-19, other diseases have disappeared. No, they are still out there. But right now, COVID-19 is taken the front position because it's becoming difficult to manage. The disease is still spreading. Numbers are increasing. I mean, we had thought it had gone down, started increasing again. In India, where they thought they had completely full control just a few months ago, no sign of abating. I mean, that whole thing. Of course, in the US and Brazil and Italy, we saw this. All right. We also need to know about non-communicable disease control. Here, when we talk about non-communicable, mainly we're talking about cardiovascular disease, cancers, strokes, injuries. These are the main non-communicable. Then we also think about personal health services. That means your family health services, your medical care. You go to hospital, you got cough, cold, headache, fever, back pain, whatever. Personal health services need to be able to, for your diabetes, for whatever. All right, you need to provide antenatal care, postnatal care, child health care, personal health services. So generally, when we think about public health activities, environment control is a big area. That's why you will have actually a separate lecture on environmental health, or I mean, it's a SCTL, which I'll be doing with you. Then there's lectures on communicable and personal health, family health services. Within this public health area, we have what we call disciplines. So right now in Malaysia, public health, remember this, is a specialty of its own. And within the public health area, we have subspecialties. So under the NSR, now we have a subspecialty, or what is called areas of interest or areas of work that's going on, right? And these include epidemiology. There will be individuals who are basically specialized in epidemiology. And now, of course, during this outbreak that's going on, during this pandemic that's out there, the epidemiologists play a big role. And for epidemiologists, all of you need to know the understanding of the distribution and the determinants of disease. Right, mostly is to be able to understand, right, the distribution and the determinants of disease, right, when we talk about epidemiology. Then, of course, healthcare managers, all the services that are being provided in the Ministry of Health, all right, the healthcare managers for each of this division that is there, whether it's nutrition, whether it's family, each of this, all right, hospital services management, right. Then family health services, occupational health, environmental health, and health promotion. These are of course I could list a few more, but in generally when we talk about public health, these are in a way, if I have to run, I mean, which we're going to be running, Masters in Public Health course, MSc Public Health course program. This will be what I call the core disciplines which have to be covered in any training in public health: epidemiology, biostats, healthcare management, family health, occupational, environmental, and health promotion. So within public health, and you will be getting lectures on this during this course, and of course most of it will also get reiterated, re-emphasized, re-discussed, and where you will have to do hands-on work when you come to year 3 in the community medicine posting. 7-week posting, just like when you do medicine and surgery and ONG, there's a community medicine posting in year 3. Okay. Then that was the areas of the public health activities, and now I'm just going to introduce you to what is called the systems itself. Okay, any questions so far?
I think no, Prof.
No, all right, I'm glad. Okay, no role, is it? No role, Anis? Huh? All right.
Yes, Prof.
All right, good, Anis. All right. Now, when we think about public health, we need to understand that we need to have a systems approach. Huh? So just like anything else, there's a system, and these public health systems are defined as all the other public systems, private, voluntary entities. Remember the beginning itself, I told you, we're talking about government and non-government and voluntary, all right? Basically, I define as public, private, and voluntary entities that contribute to the delivery of essential public health services, essential public health function. And when you think about essential public health function, it's not like what I told you, management of what? Each one of this, the communicable disease control, non-communicable disease control, and occupational health, environment, family health, that kind of thing, right? The delivery of these services, right? Entities contribute to the delivery of essential public within a particular jurisdiction. And when we say jurisdiction, means in this place, we consider the country, the state, the district, right? And maybe within the health center area. So normally, most of the time when we think in Malaysia, we're talking up to the district level, where they have got a medical office, MOH office, the district medical officer of health office, and of course the health centers come within that purview of that. Okay, so they are delivered through this whole system, right, within a particular jurisdiction. Of course, then we are talking about here in Malaysia. This, of course, concept ensures that all entities contributing to health and the well-being are recognized in assessing the provision. See, because we must remember, it is not only the Ministry of Health that is involved when a public health issue is there or a health issue is there. Every time there's a disaster, every time there's a pandemic, every time there's a major health problem, other departments in the government, other agencies in the government, all of them also involved. And right now we can see that everybody, the Ministry of Science and Technology, the context of immunization that is there, the Ministry of Home Affairs, they also, and the different immigration department also aware, affected. So everybody, the whole idea is that we must remember that all of them contribute, right? In one way or another in providing or supporting the public health services that are there. I remember, see, I've been teaching on public health for a long time. A lot of times students come into in year 2 class and say, hey, I think I'm more interested in taking care of coughing or taking care of patient, doing curative care. I'm not so interested in public health. And a lot of them do that because they really do not know the scope of public health. And as long as now, and that's what we're trying to do, that to tell you that when there's doctors out in the country, they're either in the curative services or in the public health services, providing preventive services. So your role can be in any one of them. Of course, some of you will play a bigger role in curative care down the road. Some of you will play a bigger role in preventive health care. But even those playing a role in curative care also do some preventive health care. In those who do preventive health care will also play some kind of curative role in the at the health center level, it's out there. Okay. So when we think about now, we are talking about the public health systems itself, about this delivery of healthcare systems. And I know Dr. Rahim, I think there'll be a session by him on healthcare delivery and the systems that are out there, right? We are talking about the various agencies at the state and local level. We're talking about healthcare providers. And when we think about healthcare providers, we're not talking about only doctors. We're talking about doctors, we're talking about nurses, we're talking about medical assistants, we're talking about pharmacies, we're talking about dispensers, we're talking about the health inspectors that are out there, or environmental health officers that are out there. So the whole spectrum of healthcare providers. It's just not doctors. A lot of time we think, oh, we're talking about health doctors. No. Then we also think about public safety agencies. Remember this, when we think about public safety agencies, road safety. If road safety fails, or the failure of road safety results in what? In accidents. And accidents could result in injuries. And as a result of injuries, who get affected? Healthcare system. Or what gets affected? Healthcare, because they end up coming to the healthcare system. Right? That is in the context of motor vehicle injuries. What about all occupational injuries, home injuries, different areas? So even drug and alcohol, but they are public safety agencies. Also, you must think about them as part of the system. Charitable organizations. Okay, we can see that all around right now. Education and youth development organizations. There are a lot of organizations that provide education. In fact, the Ministry of Education has got some kind of training in health. I mean, in your school days itself, but higher education, medical schools, paramedical training, all kinds of things going on, right? Also, recreation and health arts related organizations also directly, indirectly can also contribute to public health systems. Philanthropic organizations and environmental agencies like the DOE in this country, the Department of Safety and Health in the context of occupational health, they also contribute to the I would like to say the broader public health system. Okay. So remember this, the public health system is broad. It is not only supported, it's mainly driven by the Ministry of Health, but supported by various other providers and agencies that are out there. So remember this, it's not just one group of people. And among even the Ministry of Health or the healthcare system, it's not only the doctors who are, all right, the other providers that are there, the healthcare managers that are there. This is a nice slide that I found many years ago, and I continue to use it because it talks about essential public health services. So in any country, if they are required now, if they say, whether I'm in Africa, when I'm in South America, or I'm in Europe, or in wherever in the world, all right, and if we are required, or we are saying that we need to provide public health services, they would say at least these 10 essential public health services are important. They have categorized it into these 10 essential public health services that are there. Okay, and these include, what are these 10 essential public health services? All right. First, of course, is to monitor the health status and to identify the community health problems. That means we want to know what is the health status of the community. To understand the health status of the community, we need to know about mortality rate and morbidity rate. When we talk about morbidity rate, we're talking about incidence rate and prevalence rate. And right now in COVID-19, you begin to understand these words: incidence rate, and the rates that are there, the prevalence rates, right? So basically, we need to understand the health status, and the once we understand the health status, then we need to be able to address the problems that are there. We need to be able to diagnose and investigate the health problems and health hazards in the community. Okay, so like, for example, let's say there's a food poisoning outbreak, or you've gone for like now Ramadan Bazaar. Suddenly, a lot of people who went to a particular stall in that particular Ramadan Bazaar, who bought food there, ended up having diarrhea, vomiting, food poisoning. Or we had a nice kanduri, or we had a wedding celebration, one of the big Bollywood kind of weddings that are there, and a number of them who came back after dinner from that Bollywood function, Bollywood-like wedding, came back with food poisoning. We need to go out there and investigate, diagnose, find out what is the causative agent, what was the particular food, and you will learn that. In fact, in part of your public health, there will be a outbreak investigation that we will be discussing, a case study, and we will be discussing that in detail in small groups. Okay. Another, essential service is to inform, educate, and empower people about health issues. If anything you see happening now with COVID-19 is this question about informing, educating, and empowering you. The amount of information that's going out on COVID-19 about SOPs, see, to me, when I talk to somebody and I tell him, just a year ago, nobody would have heard the use of the word mask, PPE, personal protective equipment. Nobody would have heard about it. Nobody would have even have heard the word about incidence rate. Or even now we're talking about, in the context of infection, the R0, infectivity rate, that kind of thing, that, right? And people are beginning to understand the difference between epidemic, pandemic. People are beginning to understand. When it's a pandemic, suddenly they say, hey, the word pandemic, I never heard of it before. Yes, outbreak, yes, epidemic, yes, but pandemic. Now they say, oh, COVID-19 pandemic. Another essential public health service is to mobilize the community partnerships and to take action to identify and solve the problem happening. Whether it's NGOs, whether it's stakeholders, whether it's Ministry of Health, different ministries, the different partnerships with the various groups that are out there, basically to identify and solve the problem. To develop policies and plans that support both individual and community health efforts. You see, regularly, the government is working on this, having plans. And because this particular, in this case, of course, yeah, if at any other time I would not talk about so much, but here so clear that how the government acts, and a lot of times actually working within uncertainty. And I think they're doing a great job. I mean, as far as I'm concerned, I think they are doing a great job. A lot of people question that, oh, this is not being done, that's not being done. But in the broader scheme of things, they are doing the best within the scheme, within what the resources we have. And everywhere in the world, it's not only here. America, if anybody had any questions, in America, not solved. UK, problem still not solved. Europe, still struggling with it. I think there are very few countries like New Zealand, Australia, China, Singapore. They maybe have actually addressed this already kind of well, but majority of the world actually still has not really addressed this. So the policies and plans have to are continuously evolving. Like right now, whether we're going to get a third MCO or not, we are waiting. And with the kind of, and I'm sure all of you remember in this group, when the MCO came in, first they said, okay, only 2 people in one car, or only one person could go out. And I remember very clearly, my wife used to go out and do the grocery shopping, because they said 2 people cannot go in one car. And then slowly 2 people can go in a car. Then slowly all, okay, the car, other family members also, as long as they're family members, come changing. And then about wearing of masks. When do you wear this mask? Indoors, outdoors. And then about social distancing, whether you are eating in enclosed places. Like now, and I understand my wife, I think we should try avoid eating in enclosed places. That means when we go out to a restaurant, we go out where there's a bit more open air kind of thing, all right? But now they're talking about basically restaurants will get shut down, that kind of thing. They may close down, no in-house dining or whatever they call it. Yeah. Enforce laws and regulations. Of course, there are public health, the Communicable Disease Act that's out there right now under COVID. And this whole question of how these laws are getting enforced, you are seeing it. People are getting fined 1,000, getting 5,000, whatever the fines are. Okay. Then linking the people, all right, to personal health services, right? Then assure competent public and personal healthcare workers. Now that we have in this country individuals who are competent. It means they're trained, they're competent, like doctors, nurses, healthcare workers that are there, right? And basically we need to make sure that they are competent in providing. And right now I can imagine now that's what's happening in the context of vaccination. And there's a whole big national vaccination program that is out there, and the healthcare professionals are being trained of how to deliver these vaccines, right? And I'm beginning to understand that it's not that easy. Here is you get a vial. In the vial there are 5 doses or 6 doses, and each one of them you take a 0.1 ml, right? Then dilute it, then you inject it, that kind of thing. It's a whole another level of trying to understand. So we need to have competent people delivering the services. Then of course we need to continue to think about how to assess, evaluate whether it's effective or not, whether what we're doing is effective or not, whether the vaccines that we are giving are effective or not. And that's why you will see in the papers the government continuously will actually explain to you Pfizer efficacy, Moderna efficacy, Sinovac efficacy, AstraZeneca. So different vaccines and the efficacies and the effectiveness. Okay. Then of course then the question comes in of accessibility. Is everybody accessible? Can we get this vaccine tomorrow? Or how long do we have to wait? All right. And of course the question of the quality of the services that are there. And finally, as an essential public health service, research is one of them. Remember this, because without research, we will not be able to actually do much. We need to understand disease causation, to need management of disease. We need to understand about. We need to get research done. Okay. I like this slide. It was actually published in the year 1999, the end of what was called a whole millennium, like a whole millennium, 1900 to 1999, right? And what they realized basically that a lot of the reasons why our life expectancy had increased from that 58 to 74, not only in Malaysia but globally, and why we had improvement, reduction in maternal mortality rate, infant mortality rates, toddler mortality rates, right? But not so much. I wouldn't say not so much, but well, of course, curative care definitely provided some tremendous contribution to it too. But the major contributions actually came from public health interventions, vaccination, the whole introduction of vaccination. Whether we are talking, we know that the baby is born, the BCG vaccination, the whole childhood immunization program that's out there, right? Where the vaccination got introduced and being delivered throughout, and to it had very high take-up rates. Motor vehicle safety. Our cars on the road have become safer. The roads have become safer, and the cars on the roads have become. But in spite of that, many parts of the world, motor vehicle injuries are among the leading cause of death. Even in Malaysia, third, fourth leading cause of death. So they continue to push towards motor vehicle safety and safety workplaces. More and more emphasis on giving safer workplaces. And in Malaysia, not only in safer workplaces, but safer housing, healthier housing. Especially we got a large foreign workforce. We need to provide housing for them under the Minimum Housing Standards Act. All right. So we need to make sure that they're not only the workplaces are safe, but also where they stay are safe. Then about control of infectious diseases. The decline in deaths from heart disease and stroke also came about because of an understanding of public health, about measures to control smoking, about how to get people to know about healthy living, about the diet control, about increasing physical activity, more people going out to the gym. For me, I mean, although I'm not within this discussion here, but generally, I mean, I think that a lot of us have now increased, especially now with COVID-19, we have worked on improving our physical activity. Healthier foods, refrigeration, safer and healthier foods, healthier mothers and babies, maternal infant child care, good family planning, drinking water fluoridation, and of course, recognize tobacco. So if I have to think about the public achievements, public health achievement, this would be the main ones: vaccination, motor vehicle safety, workplaces, control of communicable, non-communicable diseases, tobacco use, maternal and child health. Now, right? So this was actually the introduction to public health. Now I'm going, as part of the learning outcomes, one of the next learning outcome I want to discuss is this whole question of spectrum of health and disease. So within the next 15 minutes, I will talk about spectrum, and then we'll take a break, and then we'll talk about determinants. Okay, and remember this part of this lecture is very important. You need to understand the spectrum of disease, and then the levels of prevention and phases of prevention. Okay, normally I would definitely be asking you this over and over again, not only in year 2, but also in year 3, in year 4, because to understand public health interventions, you need to understand about spectrum of disease of health. So whenever we think about disease, and you may have read this before, we have 3 phases, because in pathology you may have read about it. We have the pre-pathogenesis stage of disease, the pathogenesis stage of disease, and the post-pathogenesis stage of disease. 3 phases: pre-pathogenesis, pathogenesis, and post-pathogenesis. Okay. And now when we look at this, and please try to remember this diagram and the different things that we're talking about. See, when in this first line, we're talking about the 3 phases in the spectrum of disease. Pre-pathogenesis stage, pathogenesis stage, and the post-pathogenesis stage. So, and during this time that we're talking about, during the pre-pathogenesis stage, we normally would do what is called primary prevention. That means we do not want that disease to become covert. We do not want the disease to happen. We do not want the disease to happen. So we want to prevent the disease. So to prevent the disease from occurring, we do something called primary prevention. And in this context of this, in this primary prevention, there are 2 stages: health promotion. Sorry. Okay. I go through this slowly. There's level of prevention, there's health promotion and specific protection. So remember, in pre-pathogenesis stage, we use primary preventive measures, and the levels of prevention are 2: health promotion and specific protection. Health promotion is mainly trying to promote your healthy lifestyle, whereas in specific protection, we're trying to take specific measures like vaccination, using a personal protective equipment, those kind of things are there. Now, once, let's say, and in this pre-pathogenesis stage, we have the agents, we have the factors, right? We have the factors causing the disease, right? But they have not gone into a stage which is, in the beginning, of course, is positive, but then now they're in the negative area, and they're beginning to interact with each other. Okay? And once they start interacting with each other, there's going to be disease causation. And once this disease occurs, some part of this disease is covert disease, asymptomatic. You're not saying, so even like in COVID-19, they're talking about asymptomatic period of disease, where the person has got infected, but he's not manifesting the signs and symptoms. So, and during this covert phase, hidden, not known, asymptomatic phase, the level of prevention that we normally use is the early diagnosis and prompt treatment. We like to diagnose this disease early and give prompt treatment. And of course, once the person now, because of the disease has developed, he is now developing signs and symptoms, the disease has become overt. And here, when the disease has become overt, the signs and symptoms are there, like whether it's in your, what do you call that, in the context of COVID or any disease, you start seeing primary care, they go to the primary healthcare provider for the treatment that they're getting. And if the disease does not get better, cough, cold, running nose, whatever signs and symptoms we know about, right? They don't get better, they may need to get admission, right, in a secondary healthcare facility or even in a tertiary healthcare facility. Like in the case of COVID-19, now we're talking about a large group of people are asymptomatic, then the symptoms, there's those who are very mild symptoms, who they say no need to come into hospitals here to healthcare, right, and get treatment on your own kind of thing. Then of course, in the moment they get pneumonia, they get signs and symptoms of lung disease, then they need to get admitted to hospital, and in the hospital they may need to get admitted to ICU, and in the ICU they may need to get ventilator. Okay, so this whole system here is the idea is to limit the disability. We do not want them to get disabled. We do not want them to develop any form of handicap. All right. So in this case now, right, we are talking about the pathogenesis stage. We got two phases, two levels of prevention: early diagnosis and treatment, and disability limitation. And finally, of course, is the post-pathogenesis stage. After the disease has occurred, the person is recovered or has become handicapped. And if he's become handicapped, he needs rehabilitation. Okay, and that is tertiary prevention. So remember this: in pre-pathogenesis stage, primary prevention. In pathogenesis stage, where the disease is occurring, we're talking about secondary prevention. And in the post-pathogenesis stage, we're talking about tertiary prevention. In primary prevention, that is for the pre-pathogenesis stage, we talk about health promotion and specific protection. In the secondary prevention stage, we're talking about the early diagnosis and treatment and disability prevention limitation. And finally, rehab. Okay. So remember this: phases of prevention: 3, primary, secondary, and tertiary. Primary in the pre-pathogenesis stage, secondary in the pathogenesis stage, tertiary in the post-pathogenesis stage of disease.
Doctor.
And then in this case, we got 5 levels
Doctor?
of prevention. Yes, Nuru, Anis?
What do you mean by secondary and tertiary prevention? Like, if the person already have the disease, why is it?
Primary prevention is the type of measures that they're going to be taking at, for example, like health promotion and specific promotion. These two type of measures that they take are primary preventive measures. That means to say we go out there and talk about promotion of health, healthy lifestyle, cholesterol, reduce your cholesterol level, increase your physical activity, good diet, no, don't smoke, health promotion. Or like now in this case, when you talk about health promotion here right now, okay, we are talking like social distancing. You can think about that kind of thing, or even increase your physical activity. But when you talk about specific promotion, specific protection, and this should be better with specific protection. We are talking about the use of masks, specific protection, personal protective equipment, specific vaccination, is specific protection, and these two come under primary prevention before disease has occurred. Okay, Anis?
Yes, understood, doctor. Thank you.
So primary prevention before disease occurs, pre-pathogenesis stage. Two types: health promotion, specific protection. Secondary prevention is early diagnosis and prompt treatment and disability limitation. Okay, early diagnosis, prompt treatment, and disability are actually under secondary prevention, and rehabilitation will come under tertiary prevention after in post-pathogenesis stage. So before the disease has occurred, health promotion, specific protection, early diagnosis, prompt treatment, disability during pathogenesis stage, and the rehabilitation post-pathogenesis after the disease has occurred. Does that help, Anis?
Yes, thank you, doctor.
Okay. Yeah, good. Okay. So here the word preventive medicine is covered again. So whenever we think about preventive medicine, we're talking about the natural history of disease and covering all 3 phases. So that's why sometimes they say, oh, how come when the disease has occurred, we are still talking about prevention? Secondary, it's called, we use the word secondary prevention. And yes, you're right. Because normally we say prevent means prevent the disease from even occurring. But here we're talking about prevent the consequences of the disease, secondary prevention. So 3 phases: pre-pathogenesis, pathogenesis, post-pathogenesis, and involving 3 phases of prevention. So in the pre-pathogenesis stage, we talk about health promotion. All right, here we'll talk about increasing the process of advancing positive health. Okay, and mainly health education. If you want to think of anything about this, think about health education. Okay. Then, of course, when you talk about specific protection, is level 2. Still before the disease has occurred, before the disease has occurred, before the factors have got together and consequently cause disease. All right. We talk about specific measures taken against a person against the disease. Like immunization is the best one, or even personal protective like the mask that we're talking about. Also specific protection. In pathogenesis stage, we use secondary prevention, and we talk about early diagnosis and prompt treatment and disability limitation, where we're talking about diagnosing the disease early, good screening, right? And once we are diagnosed the disease early, we need to treat it. We want to reduce the limit the disability that can occur from the disease. And of course, finally, in the post-pathogenesis stage, we're talking about if a handicap is going to develop or anything, we need to make sure we remove or reduce the amount of disability that can occur. So we use rehabilitation. Okay, so this was just an exercise now. Now I'll take a break. Slide 23 out of 46. We'll take a break, 10-minute break. It's now 12:30. 10-minute break, and then we come back. Okay? All of you?
Okay, doctor.
Huh? Jonathan, is that okay?
Yes, I'll
Ahmad,
send the attendance link.
are you ready for a break?
Yes, bro.
Okay. Jonathan, have you taken attendance already or?
Not yet. I'm going to. Usually, I take it during the break.
But now is a good time to send a message out to take attendance. Huh? All right. I'll leave that to you, huh, Jonathan?
Yeah. Okay.
Thank you very much. So we take a 10-minute break. I should be back by 12:41. 12:40, then we can start at 12:41. All right. Okay, are we ready? Jonathan, shall we start? Jonathan? Anis, are we ready to start?
Yes, doctor can start.
Okay, all right. So we'll start. It's 12:43 now, yeah. Okay. All right, the second part of my session, basically, like this particular lecture was on components of public health and also the determinants of health, right? And this is the second part, all right? And it'll take about we should try to finish. We'll finish by 1:30, yeah. And then the two videos that I put up there, I mean, one is a PowerPoint, one is a video of an Edward Jenner cartoon kind of thing. Please have a look at it when you get back home. It's already uploaded. I don't know whether we'll have the time to show it during this session. Okay. All right. Now, when we think about determinants, I told you earlier that when we talk about in epidemiology, we say the study of the distribution and determinants of disease. And what determines disease? What causes disease? Slightly the difference. There's a slight difference in the meaning, and I will describe it in detail. But in the bigger picture, it may sound similar, but it's slightly. I mean, the terminology-wise, it's slightly different. So when we think about any disease, when you talk about ill health, talk about disability, talk about handicap. I'm not talking about death here, but I mean we think about dimensions, the different dimensions to the disease that people have. One, of course, is the physical dimension, mental dimension, the social dimension, the moral dimension, and the spiritual dimension. That's why I think even in the University of Cyberjaya, we always talk about physical, mental, and social well-being. They always talk about these three terms: physical well-being, mental well-being, social well-being. All right. And interestingly, in recent years, they've also included the moral and spiritual well-being in this whole equation. Some, of course, have used the word financial dimension to it, and some say I think that's not really true. But physical, mental, and social well-being are very important, and the moral stroke spiritual dimension is another big area. So you can some people can classify it as slightly different. Okay. Now, what do we mean by these dimensions of health? All right. First, of course, is physical health. You have health and activity for endurance. You have flexibility and strength. That means, how strong are you? Very simple. Then like somebody will ask you this question: how strong are you? Then you ask me mentally or physically. Then you say, oh no, I'm talking about physically. That means, what's your level of endurance? If I ask you to run 10 kilometers, can you do it? Are you an Iron Man? Are you a strong man? That kind of thing. Different types of strength. Then, what about flexibility and the strength of that you have, physical strength? So I remember, like right now for me, I must be honest, I've never been very much into the physical well-being part of it. I have never really been doing exercise all my life. But the good thing, of course, during this 1 year COVID pandemic, I mean, I started doing walks at least. Every day, or just 5 days a week, I do walks around in my house, just 2.2 kilometers out there. I do some stretches to get some flexibility. And I wouldn't say I do bench presses or anything to increase strength. I should, but I don't. But physically, I mean, you're talking about endurance, flexibility, and strength. Then, of course, we talk about mental well-being, your mental stimulation, your creativity, and your career exploration that you have. How's your mental well-being? And actually, sometimes some people say that during this COVID-19 pandemic, a lot of people, mental health has not been so great because they've been asked to stay indoors. They've never had to. And the mental well-being, so we need to worry about the mental well-being too. Then, of course, social well-being, developing and maintaining satisfying relationships. In fact, I think they always talk about a study that was done in Harvard a few years ago, where they say that actually what decides a person's health status or his his life expectancy and his wellness, will very much depend on this part of it, his social relationships that he has with his other members, with his family members, friends. So remember this, social relationships are also a very important dimension of our health. How well we relate with our family members, with our colleagues, with our friends, right? So we need to strengthen that too. And some people are good in having that, and some people don't do so well. Okay. Then of course moral, where we think about a moral code that's out there. Society has got serious what do you call it? Has got its own set of codes that they expect people to follow, and we normally will accept that and we adhere with that. And of course, these moral codes could differ from one country to another, from one group of people to another. Because different people have different moral codes, right? But the most important about it is an acceptable and is having a person of integrity. And I remember Warren Buffett, who is one of the richest men in the world, and he says, if I have to employ somebody, or if I have to buy over a company or somebody, and he tells me if I have to decide whether the guy is intelligent or the guy is financially smart or integrity, I will go for integrity first. And to me, I kind of agree with him. I think integrity is key, and we need to actually maintain that integrity. So, and people, society needs to have that. And finally, spiritual, seeking meaning and purpose in our life. All of us are on our own spiritual journey. Some spiritual stroke religious overlap is there, and sometimes they separate these two, all right, where we try to search a purpose. And I always wonder this question about what is our purpose in life. I try not to ask that question too much, but it's an important question. What is our purpose in life? Nurul Hanis, have you asked that question to yourself? What is your purpose in life? Azmi, Hanis, yeah.
For me as a Muslim, I think it's to worship God as a Muslim now.
Okay, good. Yeah, we must all have a purpose in life, whatever the purpose is, All right. Azmi, what about you? Azmi, I see your face here. Muhammad Azmi, are you there? Okay, but do think about this, What's our purpose in life, right? Then when we think about health, we have this whole spectrum from negative to positive health. Okay, of course, we want to be at the right at one end of the extreme positive health, right? So negative health is one end and positive health at the other end, and we are all somewhere in between. Some extremely positive, some extremely negative in the context of health, who's disabled, sick, and all that. So of course, when you think about negative health, we think about mortality, death. We're talking about serious morbidity, chronic disability, chronic illness, or minor morbidity, minor illness, right? Or typical or atypical cases of disease. So when you think about negative health, we are either talking about death, serious disease, minor diseases, okay? At the same time, in the area of positive health, right? Attainment of a full sense of personal vigor, that whole physical strength just now we talk about, right? When you talk about physical, mental, social, moral, spiritual, attainment or sense of personal vigor and mental well-being. And then social relationships, constructive relationship with each other, and in an environment that promotes longevity and happiness. Remember this. Another word that I think in recent years that is coming up more and more is the word happiness. And happiness has been linked with longevity. Are you happy? That's a good question. I used to ask myself this many years ago. See, I have had everything in my life. God has been very kind to me. I honestly, in my stage of life, I can't ask for anything more. I have a nice family. I've got a wife. I've got 2 children, a daughter who lives in Oslo with her 2 grandsons, and a son who lives with me with his 2 grandchildren, his wife and his grandchildren. Honestly, I can't ask for anything more. Then at many years ago, not now, and I used to ask this word, am I happy? And sometimes I wonder what is happiness. Again, for you to think about, you know, right? And now I definitely I can say I'm very happy. I mean, no, kind of thing. It is ideal. That's never. That sometimes we say, oh, a lot of this sometimes is never. Is completely never reached completely. Like, you know, ideal. Huh? But we need to have some kind of optimum health, right? Somewhere in between positive and negative, within the reach of most individuals, and we talk about optimum health. We can never get completely positive health with extreme, but we work towards optimum health. Okay. Now, what is going to decide? Sharif Jana has Shah, like that nice long name there, right? What will determine our positive, our negative health? And these are we call determinants, right? And here it's a very fine-tuned word that they're using. I just want to clarify. Causal factors that are grouped into precipitating causes or agent factors. That means here we're talking about causes of health, ill health, positive health, right? So the events and factors that give rise to immediate cause are termed determinants. That means they are not the immediate cause of the disease, but they are the factors that contribute to the immediate causes of health or disease. Okay, and this usually when you think about these determinants, right, can be grouped into big biological, physical, and social determinants. And when they think about this, I think the way they have done this is very interesting. They say that when you think about causal, the real like in the context of heart disease, all right, when you think about smoking, direct cause, right, physical inactivity, cholesterol level, all this direct, right? The healthy lifestyle, that's your determinant, that kind of thing, right? So determinants will account for the underlying rate of disease, while the variations in a population will be determined by the factors. So it's a bit sometimes a bit tricky to understand this, but generally they say the rate of disease will be explained. Underlying rate of disease in a population determined by it is decided by the determinants. All right, whereas the variation in these rates are determined by the risk factors. Okay. So now when we think about determinants now, so we talk about biological factors that determine health. So here we think about the biological determinants, environmental determinants, right? So biological factors means the genetic heritage, your own immunity, right? Or other living organisms that are there and how they interact with the humans. Those are biological factors, right? So biological factors that determine the health, as well as endogenous, that is within us, and those with are exogenous. Endogenous is within heritage and immunity. Exogenous are organisms that are living outside us. So think of this as the biological factors. Then we think about the environmental factors, which are external agent, biological, chemical, physical, social, right? And these are linked to the change in the health status. So we think about biological factors, endogenous are exogenous, and then environmental factors. In recent years, a lot of emphasis. That's why under our learning outcome, we have a separate heading called social determinants. And increasingly, they're saying it's not only the biological determinants, and not only the environmental determinants, but the social determinants in society of health are also very important. And these social determinants include socio-economic circumstances, in the context of economic, right? Social strata, education level, occupational level, income level, the social structure and function, and also the cultural factors. And we know in the context of socio-economic, social structure, there's a big inequality between countries and within countries. That means in the world, there's a lot of inequality in social dimension. There's the rich and the poor countries. Like right now, they're saying somehow or other, the rich countries seem to have higher vaccination rates as compared to the poorer countries. Poorer countries don't seem to be able to afford or what accessibility. So there's this what they use the word inequitable distribution of vaccines in the world between the poorer and the richer countries. And there's always this inequality even within a country, all right? There will be these inequalities between the rich and the poor, different socioeconomic strata, right? So, and Sir Michael, he says the effects on health of social processes follow the social gradient. The lower the socioeconomic position, the more the health is affected by it. That means the higher a person is in the socioeconomic strata, health doesn't affect him so much because he could go out and get the services. But if a person is poor in the lower socioeconomic, and if his health affects him, he gets ill health, it could affect a lot. Right? So another way that that we can classify these determinants, one is biological, social, and then your what's that? Your biological, environmental, and social. And the other way to look at it is personal determinants. Not a biological determinants come under that. Environmental determinants and governmental determinants. So this is another author who kind of decided that when I want to talk about determinants of health, I want to categorize them into personal, environmental, and governmental. And I like this classification very clearly because we know that certain things we can do ourselves that can determine our health. Certain things we cannot, the environment around us will depend. Like for example, the pollution that's around you, you've got no control over it at an individual level. And of course, there are many things that the government policies and programs will determine. So when you think about determinant, and I want you to remember this personal determinant and government determinant, right, and decide, and I'll give you examples of this. For example, personal determinants, our genetic endowment, our genetic makeup, our awareness of our health, and what do we do about it. The healthy lifestyle, whether we promote or we practice a healthy lifestyle or not. And our own philosophy of life. These are some examples of personal determinants. So because some people genetic makeup may be weak, very family history of disease, higher in certain diseases, or has got certain autosomal, the genetic sex-linked, genetically disposed diseases, right? Awareness of health poor, and then whether he practices a healthy lifestyle or not. Smoking, exercise, diet, okay? And what is his philosophy of life? I sometimes wonder, philosophy of life. As you see, you must remember, I turned 70 this year in January. Jonathan, I turned 70 this year, and I was thinking to myself, about philosophy of life, and what do I really want, so that I know the purpose that Anis is talking about. Very important for us to know. So that was your first determinant, your personal determinants, examples of them. Then environmental determinants, the family environment, the physical environment, the social environment, the occupational environment in which we exist, our families that we lived with. Then the physical environment that's out there, the social environment in the context of people around you and your friends and families and that kind of thing. And even the workplace, occupational environment. Okay. Then of course, in the context of governmental determinants, socio-economic development of the country, appropriate healthcare system, and political commitment. How much is the government committed to, like right now, COVID-19, good example. Think about each one of these personal determinants in in the context of health during this COVID-19 pandemic. Genetic, health awareness, healthy lifestyle, or philosophy at the environmental level and at the governmental level, whether about appropriate healthcare, the political commitment, and social economic development. Right. The WHO, all right, providing some kind of discussion around the social determinants, clearly states the social conditions in which people live and work, with how we live, how we work, can help create or destroy their health. Okay, poverty, food insecurity, whether the next meal is going to be on the table or not, whether the country, there's enough food in the country or not. Social exclusion and discrimination. Is there discrimination? What about poor housing? Unhealthy early childhood connection? Low occupational status? Each one of these actually will decide about what diseases we're going to have and health inequalities between and within countries. That means between the country and within a country, poverty, food insecurity, social discrimination, housing, unhealthy childhood, and others affect this. Okay. This, I mean, is a nice chart. I'm putting it here. You don't have to remember this, but just think of, for me, I think the earlier personal determinant, government determinant, that I think is the most important here. But this will actually talk to you about the ecosystem in which we live and give you an idea about total determinants, right? And here we're talking about we, you, I, whoever, the people. And then we have our own lifestyles, each one of us slightly different. I'm sure that if you look among yourselves that are there, within you itself, I'm just trying to see, right? And different, whether it's Khairul, or whether it's Ahmad Mukmin, or whether it's Amira or Mahdia, each one of you, I'm sure your lifestyles are different. Of course, because you are all medical students, second year medical students, there will be certain amount of homogeneity, but and at the same time some differences. But if I compare you now, the second year medical students at Cyberjaya, compared to non-medical students or art students, may be different. Or people who do not have, people in your age group, touching 20, around 20, and who never had an education. Their lifestyle will be different. The communities in which they live will be different. The economic status different. The activities will be, the environment in which the whole ecosystem will be different. So remember that you are actually in a certain level. I mean, I must say certain privilege in a way. It's a certain privileged class to be able to go to university, to go to school, get your qualification, to be able to go and get an education. All right. So you also are part of the bigger ecosystem, right? But they're different. Each one is quite different. So now that was in the context of societal health just now, the government, they see the personal determinants, the governmental determinant, environment, all right, at the moment of societal health. But at the individual health, same thing, social environment, physical and genetic. That's your personal story, all right? And this, of course, your individual will be responding to these determinants or factors that are out there, all right? And whether you will have been healthy and in good well-being, or you'll be in disease, that's another thing, and whether you will have good health care being provided or not. Okay. So this is actually, it's a very interesting way to look at this, how the UCLA Jonathan Fielding talked about that, right? And he puts it under broader categories that are out there. Because when you think about it, you've got a social environment, physical environment, all right? And at the same time, when you come into this environment, the bigger environment that is out there, you must think about the public health services that are there, as well as the individual health services. And of course, when we have these services that are there at the individual level, the biological level, behavioral level, the psychosocial level, at the individual person, how we respond to that society out there. And then we also look at the services that are there, right, that are being invested into our economy, from our economy into our health. We could either be in okay health, we could be in optimum health, we could be in poor health, or disease and disability. Of course, the closer you are towards the negative spectrum, disease and disability is more likely, right? And those who are, I wouldn't say excellent health, but what we use the word use of optimum health. That's what we can go. But I like this word that he's used the word okay health. Okay. And only yesterday, I think, it was yesterday before I heard about where the origin of this word okay came from. Apparently, it came from a particular area in the US. People who were living in this particular area, they were from there. You know, then they say, oh, he's okay. You know, that kind of thing. Very interesting. Okay health. I wonder, you know, when okay means like if I ask Anis or if I ask Khairul, how's your health? Khairul? Khairul? Ahmad Khairul Fitri.
Hello, Doctor.
If I ask you in the context of health, where would you put yourself? Optimum health, okay health, poor health, or disease disability?
Optimum health, Doctor.
Okay health. Huh?
Yeah.
Okay, what about
Okay health, Doctor.
your okay health, not optimum, is it?
Well, okay, Doctor. Okay health.
Okay. Okay, what about Aina Madia?
Yeah, I'm good, doctor.
You are in optimum health, okay health, poor health, disease disability.
Okay health.
Okay health. Wow, I'm looking for somebody with Aisha Nabiha. Anybody optimum health? Aisha Nabiha? Not sure. Amir Sali. Amir Sali? Amir Sali? And it's Selena. I'm just going through the list here in front of me, and it's easy to find out. No, I mean, okay, but think about it, whether where you fall in this scheme of things. Okay. Now, this particular writer, I like what he writes is in the context of what he's done is that in the context of social factors, he has kind of stratified them, and he's putting these factors under poverty. See, and this is a study that is done in Africa. He's talking about in Africa, the situation in Africa, where he found that certain factors kind of led to ill health or whatever. Poverty was one of them. A history of colonial legacy was there. Political instability, policy instability, lack of good governance, social gradient in the population. Each one of us, remember this, in our population too, everywhere in the world, we have the social gradient, which is determined by education, employment, income, race and gender. Sometimes race and gender may be less, but sometimes more. Right? Okay, and of course, differences in working and living conditions also will affect this, including lifestyle behavior, living environment. And as a result of these factors, there could be socioeconomic health inequality. Our quality of life, happiness, well-being can be affected. Okay, so remember that, right? There are many factors that affect our health, right? And in the context of social well-being, right? This study in Africa, for them, colonial legacy, policy instability, lack of good governance, right? I think social gradient, I mean, everywhere in the world, and then even like differences in how each one of us, I mean, just look at ourselves and the people around you, and the people not around you, but in the broader scheme of things out there, leading to health inequality. And here we're mainly talking about health inequality in the context of life expectancy, morbidity, mortality, because disease patterns could vary. Life expectancy could vary between the high income group and the low income group. Okay. And by changing lifestyle itself, like for example, like Hubel talks about itself, just by changing lifestyle itself, it is possible to avoid up to 80% of coronary heart disease, 90% of diabetes to type 2 diabetes, and 1/3 of cancers. We talked about this now. Remember that in the beginning itself, I talked about preventable disease, preventive, prevention, and I like this report by the WHO FAA report. It talks about lifestyle change alone, and I think I agree with that. 80% of heart disease, 90% of type 2, third of the cancers can be prevented. And uses the word avoided. So now, of course, for that, and this is part of actually a bigger non-communicable disease program within the EU and the European Commission, right? And they said it is very important for us, if we want to do this, we want people to change the lifestyle. The whole thing was to change lifestyle, programs to change lifestyle. We will need to develop partnerships for the specific non-communicable disease, for cancer, for diabetes, for heart disease. We will need to work across the life cycle, young children, young adults, adolescents, young adults, middle age, older age group, and we will have to act upon the determinants of this non-communicable disease. You don't have to remember this, but just this is for you to just understand. If I want to try to reduce non-communicable disease in this country, whether it's heart disease or stroke or cancer or whatever, all right, I think it is possible. We need to have increased groups of people working on this. We need to act at different age groups. You could start with young and in the young. That means diet, basically exercise, physical activity. You should start them with young itself. I have never been actively involved in physical exercise. Somehow or other, I think I feel the same when I was young, but now, of course, I've caught up with that. Okay. So in this case, same European Commission, when they talk about health determinants, and mainly we're talking about non-communicable disease, right? We're talking about unhealthy diet, physical inactivity, tobacco control, and tobacco use and alcohol. So remember this, for NCD, unhealthy diet, very important. We need to change the dietary pattern of individuals. We need to increase physical activity. We need to think about getting them to stop smoking. And we need to think about alcohol, curtail alcohol use. Because with each of these different determinants, they could affect different diseases, like some of them affect CVD, some of them affect cancer more, some of them affect diabetes, some of them COPD, some of them affect mental health, musculoskeletal, oral health. So we look at this, it's a very nice diagram. You don't need to remember which arrow is going, but have a look at it, reflect upon it, think about it. Okay? Madia? Aina Madia? Okay.
Yes,
Similarly, yeah. Okay, good. All right. So in a similar fashion, in the same report, actually, Hubel talks about this. He mainly talks about non-communicable disease, right? In the context of determinants line. We're talking about determinants here, and NCDs are the big thing that we all worry about, right? Lifestyle, smoking, alcohol, eating, like just now the 4 factors that they were saying are the causes that are there, right? But you think about it, this become the determinants. These are the causes: lifestyle, smoking, lifestyle changes, smoking, alcohol, eating, diet, all that. But now what is going to cause this? The causes of the causes, and this is the determinants: income, access to education, health services, rights, discrimination, socioeconomic status. A lot of this will cause changes in the causes. So what will determine these causes is called determinants. Remember, these are the causes. When we talk about causes, we talk about direct causes, whereas determinants, we talk about causes of the causes. Okay, just remember, determinants means we are talking about causes of the causes. Causes are those which are directly related to the outcome of interest, the health outcome, disease outcome, ill health, disability, death, whatever. Okay. In similar fashion, when he thinks about this, he wanted to know what is a different impact of the different causes of health inequality. And here we are looking at living conditions, work and working conditions, services and access to services, health-related behaviors. All of these are those that can affect the causes. So your living conditions, your services, these are determinants in a way. If I use the word again, determinants, although he hasn't used it, work and working conditions, your job quality, health and safety at work, your life, your health-related behavior, smoking, alcohol, exercise, whether you have access to services or not. See, like right now, I'm just thinking, we have a large number of foreign workers in this country, right? And if I have to think, if I have to put this diagram here and this picture here, and I have to think about the diseases or the outcomes, the health outcomes that they have, or their stage on the spectrum of health, and then I have to think about the causes, and then I'll have to think about the determinants, and I think of the living conditions they work in, they live in, their working conditions, whether they're available to get access to healthcare or not, and their health-related behaviors. Definitely going to be different from Malaysians. And then even within Malaysians itself, they could vary, so they could vary. Okay. There's this very important declaration that came about on social determinants. That is why we have a separate, what do you call it? Learning outcome on this, right? Because everybody talks about this Rio Declaration, all over the world, countries have kind of ratified or signed onto this Rio Declaration, right? To say, okay, we need to determine, we must be determined, the country must be determined, the members in this organization and who are signing this declaration need to be determined to achieve social and health equity. That means there must be both social and health equity, right, through action on social determinants of health and well-being by a comprehensive and intersectoral approach. That means we need to do intersectorally. Okay, I don't expect you to remember this Rio Declaration, all that whatever is written here, but just to go back and know that there's something called Rio Declaration. And for that to happen, we want to have the social and health equity. We need to have better governance in the countries. We need to promote participation in policy making and implementation of different sectors. We need to reorientate the health sector towards reducing health inequity. We need to strengthen global governance and collaboration, and we need to monitor progress and increase accountability. This is at the global level. I said at the present moment, there's too much of inequality globally, inequity globally in the context of social, in the context of health and well-being. And this is mainly what is causing this in our social determinants. So we need to address them by this intergovernmental, so a broad spectrum, intersectoral approach that is there. Okay. So what I've done in this second part of this lecture is to cover issues related to determinants. These last two slides are very, in a funny, in a way, sometimes I use the word funny, but it's not. And they're just telling you, Liam Donaldson, who's the Chief Medical Officer in UK, he says he's giving you 10 tips for better health. And I like this slide, both the slides. Sometimes it sounds a bit funny. Don't smoke. If you can stop, don't smoke. If you can, stop. If you can't, cut down your smoking. 2, follow a balanced diet with plenty of fruit and vegetables. This is for better health. Don't smoke, follow a balanced diet, keep physically active, manage stress by talking things through and making time to relax. If you drink alcohol, do so in moderation. They don't say you must drink or or drink excess. Carve up in the sun and protect children from sunburn, because in certain parts of the world, skin cancer is common. Practice safer sex for better health. Take up screening opportunities for cancer. Be safe on the roads following the highway code, and learn the first aid of ABC, airway, breathing and circulation, when you're talking about first aid. So they say it is good for you not to smoke, follow a balanced diet, keep physically active, manage your stress. If you drink alcohol, that is, do so in moderation. Come up in the sun. In fact, right now, every morning I go out and sit in the sun for a few minutes to get some kind of thing, my vitamin D kind of thing. Practice safer sex, pick up cancer screening, safe on the roads, and learn first aid. And finally, this one is this is where I was saying funny response to this 10 tips line, you know, because he had given 10 tips and this guy is responding to that 10 tips. He said, don't be poor. If you can, stop being poor. If you can't, try not to be poor for long. I thought it was the way he put it is very funny, but very true. Don't live in a deprived area. If you do move, this is in the context of socio-economic housing areas, because we all know that in the deprived areas, socio-economic, I mean the opportunities are less and the whole interactions are poorer. Be able to afford to own a car. Don't work in a stressful, low-paid manual job. Don't live in a damp, low-quality housing or be homeless. Don't be able to afford to go on. Be able to afford to go on an annual holiday. Don't be a lone parent. Claim all benefits to which you are entitled. Don't live next to a busy road junction. This is like feng shui kind of thing. It looks like it, or near a polythene factory. And of course, use education to improve. I think don't have to remember these 2 slides at all, please, sir. Don't try to remember, but to reflect, read it, reflect it, think about it. All right, but I don't expect you to remember, oh, please tell me what are the 10 or one of this, the 10. No, but just enjoy that process. Okay, that was my last slide for my lecture. I have 5 minutes for any questions or answers. Any questions, answers?
Prof.
Yes.
For the public health.
Yes.
What I can understand that is quite a major. It has its own branches.
Yes.
But let's say it has its occupational safety and
Yes.
also have maybe some parts of nutritionist part. So does it have the same job scope as people for occupational safety or nutritionists, or does it have its own?
I have been working in occupational health for the last since 1982. Of course, in my case, I've been actually mainly involved in teaching occupational health, right? But at the same time, I was also advising government or sitting in committees, all right, in the context of regulations. Like I remember in the beginning was the lead regulation, asbestos regulations. Down the road, other regulations came about, right? So basically, our job scope is similar. The only thing is that the occupational health doctor, it will all depend where he works. If you like, I've got many friends who are part of what is called a Malaysia Corporate Health Advisory Forum, MCHEF. These are medical advisors to Shell, Exxon, BASF, GE, different companies. They work at the corporate level. Then we have a lot of doctors who work at the plant level, who are company doctors who advise the companies at an individual level. They go do the plant visits, spend half a day in this factory, half a day in another factory. Then there's another level which are doctors who are panel doctors to these factories. And then of course there are people like us who are also educators. So within each of these areas, at least in occupational health, we doctors have a very specific role. A lot of the doctors are called occupational health doctors. Some of us, of course, occupational health physicians when you already have a consulting level. Okay, Aman, does that help you?
Oh, all right.
Yes.
Thank you.
There's also the safety health officer there. His roles are different. The industrial hygienist role is different. Agronomist role different. Toxicologist role different. Occupational physicians have their own role. Amar?
All right, understood. Thank you.
And I always tell my class whenever I used to give my lectures in UKM, I said in a class of 182 or whatever, 92, if 2 or 3 of you end up doing occupational health, I'll be very happy. Of course, I have a lecture with you on occupational health where I'll try to convince you also again, Amar. Yeah, okay. Any other questions?
Doctor,
Yes.
for the back to the pre-pathogenesis and pathogenesis.
Right.
For the post-pathogenesis, is it just rehab,
Yes.
or is it
Yes.
both disability limitation and rehab?
No. If you look at the graph out there, I like that. That means you're thinking about it, because I did change a slide last night. There was I did change a slide last night, and I've already put that change in and I uploaded it. So if you had downloaded it earlier, you would have seen it different. Okay. If you look at this diagram here, okay, when you think about primary prevention, secondary prevention, tertiary prevention, and then you look at pre-pathogenesis, pathogenesis, and post-pathogenesis. So here, primary prevention comes in pre-pathogenesis, secondary prevention, pathogenesis, and rehabilitation, this tertiary prevention, post-pathogenesis. Rehabilitation comes under post-pathogenesis. Disability limitation and early diagnosis and treatment come under pathogenesis. Okay?
All right, thank you, doctor.
Yeah. Because in fact, if you had seen, the one that I sent earlier version, I made a change to this here, where this one in that earlier version I sent you, level 4 was put under post-pathogenesis, but I made that correction. Okay, Anis?
All right, thank you, Prof.
All right, good. Any other questions? Okay, if there are no other questions, I'd like to thank all of you. And I noticed that, at least for me, I do not have any other class with you this week. You please do take care and drive safely. Have a Ramadan Karim. Take care.